guys, I am Kathleen Apinat and I am a student nurse at the Davao Doctors College. So, I am going to demonstrating to you the assisting with ambulation without aid.
The current medical record of the patient was able to present activities, and the current weight is 40 kilograms. The medical history of the patient with left-sided weakness and without shows of hypertension.
Step 1. Review medical records for patient most recent activities experience. So this is done to be able to identify and assess the status of the patient. Then step 2. Review medical records for history or risk of orthostatic hypertension, and then this is done to be able to identify the patient's limitation during ambulation for patient safety. Then number 3, review healthcare providers or for orders and for activity notes for mobility or weight being restriction. So this is done to be able to identify and verify the doctor's order, and also this is done to be identified as special consideration when assessing the patient.
The patient chart shows doctor's order to ambulate patient once a day every morning, so the patient is able to move both lower extremities and with consideration of with sided weakness of right lower left.
Number 4, determine best time to ambulate. Schedule around after the activities. So this is done to maximize the energy of the patient. So number 5, then checks the patient environment. So this is done to provide safety to the patient and to prevent injury.
As for doctor's order, the best time to ambulate is in every morning after breakfast of the patient. And also the patient have energy to move and have time to rest to the following activities. Since the patient environment has no barrier or safety risk, so it's time to proceed to ambulation.
Number 6, identifies patient using at least 2 identifiers. So to verify if you have the correct patients during the procedure.
Sir, unsa gyud mo pangalan, sir?
Ako di ay si April Dave Sante,
Kano sa imong birthday, sir?
November 23, 2004.
Okay, thank you.
Number 7, perform hand hygiene to prevent the spreading of the microorganism. The number 8, assess patient's readiness to ambulate. First, you have to assess baseline vitals. So this will serve as your basis or baseline data of the status of the patient. So first, you need to check the heart rate, blood pressure, respiratory rate, and the temperature. Next, assess room and muscle strength of lower extremities and bed if necessary. So this will allow you to identify and assess the patient capability and limitations. So third is ask if the patient is tired or experiencing pain. Determine source of severity of pain. Administer analgesic if necessary. So this will this done to able to promote comfort.
So, sir, gikapoy pa ka karon, sir?
Wala man man.
So, sa imong TL na kayo na-feel nga sakit?
Wala.
So, sir, willing ba ka nga sa karon na activity na nato para magbaktas ka kanya maglakaw-lakaw ka? Willing ba ka, sir?
Oo.
Sir, malit ni mong TL, sir?
Oo.
Tapos, sir, magbutang ng pressure, sir, niya imong asan yung TL na ugmaan siya nimo. Tapos, sir, imong pagpilit pa much. Sir, makadungog man ta, sir, do?
Oo.
Kay importante maguna sir kay magatag mong kog instruction no para madali lang ka makasunod sa ako ang makuman sir. Wala may problema ana sir no nga pagong tigong. Pakilit na sir ha. So, elevate the head of the bed, then lower the position of the bed, and then place the non-skid wear shoes to the feet of the patient. Sir, mag-check of vital sign mo sir. Buka lang po. Sir, mabutang ko kamot sa imong shoulder sir ah. So sir, akong giuna ibaba ang imong tiil sa round ni Kuya. Sir. Sige, 1, 2, 3.
Number 14, allowing patient to sit for a few minutes, flexes extended patient's feet and more, moves legs up and down, cheeks blood pressure if necessary. Have patient relax and breathe if he or she feels dizzy, then returns patients to bed if necessary. So, allowing patients to rest allow homeostasis in the body of the patient to be able to recover and to prevent orthostatic hypertension. Number 15. Applies gait that appropriately hold beds properly once patients stand. Yung number 16, Help patients to standing position with shoulder back. Assess ability to bear weight and balance. So number 17, returns patient to bed or chair immediately if he or she is unsteady, obtain additional help. Then number 18, place IV pole on side of infusion, instruct patient to push pole while walking. Then number 19, empties drainage bag if necessary, because ensure bag is carried up appropriately and that there is no tension on tubing. So, and number 20, decide with patient how far to ambulate.
So, pagkakaroon, sir, pwede sa ka magpaulay. So, malihot ba naman yung tiil, sir? Dito,
Oo,
sir.
mali.
Ayun, so, imo dong tiil, Drex. Ano. Okay, sir. So, feel nyo sa karoon, sir, ka lang. Malipong ka. So, sir, magbutang po gate dahil sa akin. Support niyo sa simo niya pagtindo. Sir, butang na po ako ang kamutin ko, sir. Hindi ko kamot, sir. Butang ko po, sir. Ikamagiyag. Count ko, 1, 2, 3, sir. Sabay ko na sabay ko dito. 1, 2, 3. So, this is an IV pole because we don't have IV pole so we use chair. So, sir, kaning IV pole, makatabang siya sa mo para magdakaw-lakaw ka. So, sige, sa gamita, sir. Makaw, sir. So, sir, gikapoy na ba ka?
Wala.
So, okay lang ba sa imo, sir? Padayon, nagdakaw-lakaw, sir.
Okay naman.
Kaya dili ka, boy. Sige, sir, lakaw to, sir, lakaw, sir. Sige, sir, lakaw, sir. Sige, sir. Sige, sir, lakaw, sir. 1, 2, 3. Kaya, sir, dili man lula atong tiil, sir, no? So, balance, sir, dili